Hello and welcome to the multi-level health information modeling tutorial series.
In the previous sections, we tried to explain why healthcare information has a nature that is different from the nature of the information for any other industry of the human society. So this different brings a specific dynamics and a specific complexity in healthcare. Healthcare systems are much more complex than everything else in the world regarding three dimensions: the space, the time, and the ontology. Let's talk about the spatial complexity first. You can have two municipalities. One is a big city with millions of inhabitants, but maybe it is part of this metropolitan area, a small suburb or a small village. It depends on the country that you are in. Here in Brazil, we have São Paulo or Rio de Janeiro, huge cities, and sometimes you have a semi-urbanized small town with 20,000 inhabitants, and they are adjacent. Of course, you can have those two groups of geographic areas, and even if they are adjacent, people that live in those areas might have completely different healthcare needs. Of course, that depends on your income. That depends on the infrastructure of those two geographic areas. It depends on cultural difference. It depends on so many determinants. But the fact is that those two areas, they might be close to each other and be completely different in the type of healthcare system that you have for the population there. Better said, you can have two neighborhoods inside the same municipality, and they might have completely different healthcare services, especially in a very unequal country like Brazil. Sometimes you have upper middle class neighborhoods that are adjacent to communities of working class families, and the healthcare needs of those two populations can be much different. And usually the lower income populations, they have more needs and more basic needs for healthcare than the upper class population. But what happens is that it's not that all the problems of the upper class population are solved, because given the higher consumption of food, or because they are more sedentary and etc., they might require a completely different type of approach for their health. And those things need to be taken into account when decision is being made to provide healthcare services for two neighborhoods that are in the same larger geographical area. That said, you can have in the same street two buildings, and depending on the profile of the families living in those two buildings, you might require a completely different healthcare service, a healthcare approach to those two buildings. This is important when you have programs like family health or similar services when people are visited in their houses, because the healthcare professionals that are making those house visitations, they need to be aware of the fact that the profile of one family to the other, just changing from one building to the other, might change completely, and you need to be prepared for this complexity and these dynamics. Better said, two people living together in the same house might have completely different healthcare needs, even if it's a couple. Okay, because of the gender differences of men and women, there are some specific healthcare services for women's health and some specific healthcare services for men's health. Of course, many things will be in common, but those two people are unique and they will require different services for healthcare. And if you start to expand your family living together, like having an extended family, that is still common in some areas where you have the grandparents and the parents and the children all living together in the same place. Of course, the grandparents and the grandsons and granddaughters will be completely different healthcare needs because of their age, because of their history, and because of the uniqueness of the people that they are, even living in the same under the same roof and being from the same family. Better said, you look at yourself and your feet and your heart. They do have completely different healthcare needs. If you rub your anti-hypertensive medicine on your calluses on your feet, that won't make any good. And if you take the lotion that you're using on your calluses to make your blood pressure go down, that won't be a good idea either. That means that for specific problems you need specific treatments, even if it's yourself. This is something that sounds so obvious, but the fact is it just shows the complexity even into your own body. You have all this complexity and all these dynamics, and people must, of course, you need to look at yourself in this holistic way, but only being holistic and not taking into account that that you require some specific treatment for some specific problem is very important, even if you are a unicist homeopath. Actually, this is something that they understand perfectly. It's just another way to look at medicine, but the fact that there is something that is unique for your treatment doesn't mean that you won't have different ways to do this treatment depending on what are the symptoms that you're presenting now. Better said, in the future, now we already know many diseases and how the genetic alleles are connected to some specific diseases, and that will be turned in a very near future in genetic treatments. And those two genetic alleles, and they are living together very close in the nucleus of every cell of your body, and they can determine completely different diseases, and they will require completely different genetic treatments. And so this is the spatial complexity of healthcare. It doesn't matter what's the zoom, if you're looking at large geographic areas, or if you're looking inside a specific cell of one individual, you will always have very specific healthcare needs. It doesn't matter what's the zoom that you're looking at. But let's give a zoom out to make it more systemic. This is the hospital complex of Santa Casa, that can be freely translated as the Holy House in Brazil. For many years, for many centuries actually, the holy houses were the only healthcare services provided in Brazil. And so if you look at this this graphic, you see that there are some some buildings here in the center of this complex. There are very ancient. They probably from the 18th century or 19th century. And you have others, especially the child hospital. He's here in the extreme left corner, that are much more modern, and you have some other services like the Santa Clara polyclinics. And if you look at this hospital complex, it is obvious that well, the name is hospital complex, and so it's already in the name of this structure that it is a very complex healthcare service. Actually, you have such a variety of workflows and such a variety of clinics, and the case mix of patients that you have coming inside those services will be so diverse that it's very difficult to think that it will be possible to make one megalithic healthcare information system that will take care of all the specificities of such a complex hospital complex. And we are only looking at one hospital. Imagine that if you zoom out more and more and more, and you start to include the clinics that might be here in front of this hospital complex, and you have GPs in those clinics sending patients to this hospital complex. Oh, so let's include those GPs in our megalithic system, and let's include the laboratory clinic that is across the street, and so let's include everybody and make this system modular, but it will be the same system so everybody can talk to everybody. We only cross the street and look at the complexity of this kind of approach. It's not operational, not even if you think about one neighborhood. Even for this isolated hospital complex, it is not feasible in practical terms.